This is Group Number 7's Grand Challenges project. Grand Challenge Number 1 is addressing environmental health risks on campus. The challenge is reducing exposure to environmental hazards on university grounds that affect the health, safety, and well-being of students, faculty, and staff. The issue is that campus environments face multiple risks such as poor air quality, inadequate waste management, and limited access to green spaces. Buildings may have outdated ventilation systems, exposure to allergens or pollutants, and unsustainable maintenance practices that contribute to long-term health impacts. For communication, a collaborative approach would include increased transparency in environmental monitoring, educational campaigns about sustainable living, and interactive dashboards displaying air and water quality data. Promoting open communication between facility management, students, and researchers. Ensures shared accountability, partnership with environmental science and public health departments could also drive innovation to sustainable campus design, green infrastructure, and pollution reduction strategies. Our goal is to create a safer, healthier, and more sustainable campus by aligning design, communication, and policy to prevent environmental health risks and support long-term well-being.
When we're talking about the Grand Challenge 1 of addressing environmental health risks on campus, it's important to consider who's involved. So the first group that's involved is facilities management, and this can include facilities staff who are in charge of maintenance, ventilation systems, and waste management, as well as many other things. The next major group involved is the faculty, which contribute to addressing environmental health risks through their research, integration in their curriculums, and creating different initiatives. And the last major group involved are the students, because they are also impacted by the hazards on campus, and they can address them through educational campaigns and through reporting their concerns. And it's also important to consider the complexity of the design, which in this case, it's very complex because it requires the coordination of different disciplines and group members. So it requires the coordination between facilities, faculty, students, many more people, and it also involves different monitoring equipment such as air and water quality monitors, as well as different data systems. And it also requires the coordination of different initiatives created by different faculty members and students, as well as any educational campaigns or policy activism.
Grand Challenge number 2, which is communication to overcome the spread of misinformation. The challenge is the rapid, overwhelming spread of false and inaccurate information across all digital platforms. This isn't just about bad or misinformation, it's about the sheer volume and speed that it makes it impossible to contain. And the issue lies in social media's core design, where there's algorithms that prioritize content based on engagement instead of more factual accuracy. This means sensational, often false narratives are rewarded as it has a much more wider reach. The problem is now severely compounded by advanced AI, which makes creating and verifying content increasingly difficult, which hinders public trust. To address this, we need a collaborative communication strategy that focuses on prevention, which one solution could be developing stronger machine learning models to automatically detect and flag deepfakes and false information at a large scale. Another is implementing wide-ranging programs to boost media literacy among the public, ensuring users have the skills to critically evaluate content and adhere to necessary frameworks. Ultimately, fighting misinformation requires both better technology and a more educated public, and by investing in both, we can secure the integrity of our information ecosystem.
Identify these challenges. So for Grand Challenge 1, which is about addressing environmental health risk on campus, our first source were the emails that are often sent by the University of Maryland Health Center and the Office of the President. Some recent examples include the rise of COVID-19 cases previously during the winter, and even the short outbreak of lice we had this semester. And so oftentimes these emails had information about the cases and how to avoid them, as well as areas of contact. Another source for Grand Challenge 1 are how specific schools and majors on campus that utilize labs. So the most common ones are the biochemical and physics labs. Many times they require their students to complete safety modules, so they're aware of how to use the proper equipment, as well as having knowledge of how to deal with some dangerous substances, especially with the bio and chemical labs. And another source for Grand Challenge 1 is how our university facilities and management corporation, like Work, many times they have helped students with health-related incidents and risk in the dorms, as well as any buildings on campus. And now moving on to our sources for Grand Challenge 2, which is about communication to overcome the spread of misinformation. As teenagers and college students, we often use social media very often in our lives, and the increased use of social media has promoted viewership of AI deepfakes and fake content. Some really common examples are how people will create fake celebrity statements or videos, or even create fake news posts, which look very realistic but aren't verified by real sources and are often sometimes just made by random people. And since we are often on social media as college students, we often witness the spread of misinformation. Another source for Grand Challenge 2 was the COVID-19 pandemic, which we all have experienced. And that was a big time of constant debate for misinformation in regards to case numbers, the origin of the virus, how it spread, and things like that. And a more generalized source for Grand Challenge 2 is related to politics. Many times politicians use misinformation on their opposing candidates to sway public opinion.
Why the challenges are important, specifically the environmental health risk on campus. Environmental health directly affects students' well-being, campus safety, and academic performance overall. Some examples are disease outbreak, poor air quality, and unsafe building conditions in labs that disrupt learning and increase stress for these students. Because campus populations are typically crowded, small hazards can escalate quickly, which leads to the quick transmission of sickness and exposure to contaminants in these areas. Addressing environmental health risks is important for equity because vulnerable groups such as disabled students and student workers in these labs and these environments face greater impacts. The university has legal and ethical responsibilities to maintain safe learning, living, and working environments, making design and prevention a critical need that has to be faced. Why the challenges are important, specifically the communication and misinformation. Misinformation spreads fast on popular social media platforms that are used by college students, such as X, Instagram, and TikTok. This allows for false claims to overshadow verified facts. AI-generated videos and posts make misinformation harder to detect, threatening trust in science, health professionals, politics, and the institution. On a college campus, misinformation affects students' health behaviors, civic engagement, and safety decisions. For example, when the COVID-19 pandemic struck, there was much controversy on social media platforms that helped create misinformation spread amongst many college students. Effective communication is a grand challenge because designers must create systems that are transparent, trustworthy, accessible, and able to overcome misinformation that is being spread. Who might work on this in the future and required resources needed? So who will work on this? Campus health and safety teams, that includes the Environmental Safety, Sustainability, and Risk, which is also known as the ESSR, and the health center and health researchers that are on campus. Another group is students and academic departments such as the engineering department, environmental science students and department, information science, computer science, public health students, and many other fields. Digital information experts, that includes journalists, policymakers, data scientists, and engineers. Resources that will be needed for this are detection tools such as air quality and pathogen sensors, and platforms that can easily detect false information or any AI-generated systems. Communication systems such as health warning alerts, early warning systems, and content labeling to warn users on campus. Education such as media literacy programs, improved lab safety, and educational seminars for students. and overall investment in infrastructure. That includes faculty, surveillance technology, and quick responses to systems.